I think the straw that broke the camel's back for me to leave the traditional insurance-based world to start my own direct primary care was when I would feel the need that I had to keep moving on to seeing more patients, and a patient would be sitting across from me crying and telling me about what was going on in their life. And I literally did not have the time to sit down and listen to them when they really needed a shoulder to cry and they needed someone to listen. And I felt torn because I knew I had to keep moving. Hi, my name is Dr. Katriny Ikbal. I'm the physician and owner at DirectMed. So I think that the traditional medical system right now is broken. There is a problem with insurance companies reimbursing physicians less and less, and that way now physicians have to see more and more patients just to meet their overhead costs, and patient care goes down. So in the traditional model, these practice administrators are basically business people that are helping organize how care is being delivered from a physician seeing patients all the way down to medical assistants and the check-in for people. They limit the ability for a physician to actually provide excellent care because they're more interested in getting high volumes in and out of these clinics and in and out of hospitals to have to put more money into their pocket. I was seeing patients anywhere from 7 to 15 minutes for their conditions. That included a problem-focused visit or a comprehensive exam. So it was really limited on the time that I had with patients. As a physician, it's very frustrating for me to not have the ample amount of time to listen to my patients and help address their concerns. In my previous position, I literally would have like one hand on the door and trying to figure out what prescriptions to hand that patient because I knew that I had 10 other people waiting for me. So it was very frustrating in that system. So direct primary care is taking medicine back where it was 50 years ago. It's reestablishing this relationship between the physician and the patient and removing third-party insurance companies from the equation. Direct primary care is basically a gym membership to your doctor. You have your doctor that you see for kind of every issue, and they'll help you through that process of whether they can address something or if you need to be referred out. Ideally, a relationship between a physician and a patient should be an open communication. We should feel comfortable to discuss difficult topics, to talk about things that a patient might have been hesitant to talk about, because if we can actually talk about those things that are their biggest fears, a lot of times we can address the root cause of what's brewing, what's the underlying issue. My patients have an open communication with me. We have an hour-long visit for most visits. They still have access to me by phone, text, and email outside of the office to help address any questions, concerns. So I feel like my patients really are heard in this type of setting. 2 is the continuity and access to care. So they have access to me pretty much 24/7. And continuity is I'm a solo practitioner, so they're always just going to get me. I don't have a mid-level that sees them for their sick visits. They're going to still be seeing me in between all their chronic management visits. And then 3 is transparency. Direct primary care fosters this idea of medical transparency. And so there's no hidden cost to anything in direct primary care. It's very transparent. So no words can really describe how rewarding it is to be in a direct primary care practice. Through my residency, through like undergrad, through all my training, through all the mentors that had practiced primary care even 50 years ago, they've all taught us about having this deep relationship with our patients because that helps foster better care. And now that I'm in this direct primary care setting, I'm able to deliver that, and it's just rewarding beyond measure. I'm just so happy on what I could do, and I feel like my patients are giving me positive feedback on that, and that it's a win-win for both parties.